Welcome. We have 1 hour to talk about 4 different personal outcome measures and decision making on those. What we have tried to do during this, for this webinar, is we're going to make a scenario, and you're going to be introduced to Joe. And Joe you will be doing some scenarios and then making some decisions based upon those scenarios, whether or not the outcome is present and whether or not the support is present. What we have found many times is that knowing that the personal outcomes are not in our realm of control, that it is really about the person themselves, and that we want to make sure that everybody sees those in the same way. You will have only the scenarios to make your decisions about, and we're going to be doing some polling. So with that, we're going to go ahead and get started. So in reality, we have about 15 minutes for each one. And so as Kathy said, we'll be doing some follow-up on questions and such. But you'll have a little bit of time after each outcome decision and each support decision, or after both, to think a little bit and write your questions for that. So to begin, we as CQL always, the change inspires us, so we're hoping with this whole series that we can give you some answers to questions that you might have, especially around people who might not communicate in English or with our language or use some other sort of communication to understand that. So as we go forward, we know that it is a continuous journey and never a destination. We're going to be looking at, of course, the quality of life and the quality of services for people, because our definitions, we measure and define those things. So we're going to start with people are safe for the personal outcomes. I'm going to read this to you very quickly, and you can follow along. I know everyone can read. So, but Joe lives in a house with 5 men. He does not use words to speak and depends upon staff to interpret daily wants and needs. He requires assistance to complete all areas of personal care. When discussing his safety, staff stated that Joe is usually okay with leaving the house for fire drills, except when it is cold. He attends a day program, and the staff who works with Joe in the home was not sure if there were any issues at that place. Joe likes to use his wheelchair to go on walks during the warm months, and when his neighbor's dogs bark, Joe seems to be a bit nervous. At those times, staff are told to say, "You are okay. The dogs cannot get out of the fence." We are going to be using a poll for this, and the questions, if you do not have your workbook, your manual with you, excuse me, is, does Joe live, work, and pursue leisure activities in environments that are safe? And this is based upon what you just read. Does Joe know how to respond in the event of an emergency at home, at work, or in the community? Are all of Joe's safety concerns addressed at home, at work, and in the community? We're going to put a poll. We'll give you about a minute to decide. I will go back to the scenario so you can look at that, and we will want you to poll then. Kathy?
And so, Jill, 36% of the people said the outcome was present, and 64% said no. So I'm going to hide the poll now, and you can go back to your scenario.
Okay, when we were looking at that, the answer is that we would look at it that the outcome is not present for Joe for a couple reasons. One is that we don't know what's going on at the day program. And so we don't know if there was anything that was going on there that we do that. We look for the holistic part of Joe's life. And so we would believe that the people that live with Joe would know what's going on at the day program also, if there was anything else. The neighbors barking dogs when he walks around his neighborhood, to simply say you are okay, the dogs can't get out of the fence. We don't really know why that is. Has he met them? Is there something else we can do? Could we not go past there? What are the other things that we might be able to do rather than just saying you are okay?
So now we'll launch the poll for, oh, I'm sorry, go ahead.
Not yet. And then we've got the supports for people are safe for Joe. The things that are important in the decision making are that people are safe, and the supports are that education and support. The first question would be, is there an assessment of safety issues? And the second thing are supports there to address identified safety concerns. With the new manual, we have 4 options to that. Yes, the supports are in place. No, but they are developing plans. We do it. Or 3, we're aware but have no plans, or simply no, it is not in place. We're going to poll now for which of those 1, 2, 3, or 4.
And we have about 75% of the people voting, and it's been up for a minute, so I'm going to close it now, Jill. And so the results are that there are supports in place. 8% of the folks said that. No, but there are developing plans, 8%. No, aware but no plans, 46%. No, not in place, 39%.
So most of you said that they were either aware or not in place. I think that either one of those would be possible. What we had decided is that no, they are aware, but they don't have any plans. So most of you did choose the one that CQL would have put in there in the database that we put in our portal. So it would aware. They know that the dogs are an issue, and they're aware of that, but those plans could have been bumped up a little bit more robust or not in place. Either way, it would give you an option and an opportunity to look further as to what it is that Joe would like to do or where to go with that. So very good. So we've got a few minutes, a couple, 3 minutes for questions. If you'll type in, if you have those, and Kathy will kind of filter those that might be more global. And as she said, we'll get back to any of you that have questions. So if you'll just take a couple minutes, if you have additional questions. We know that you have scenarios of your own that are very different and have lots of different nuances in them. And we will try to get to that in this hour. We are a little less able to take everyone's questions.
Okay.
So we'll give you. Go ahead, Kathy. Sorry.
It's all right. So the first question. Sorry, I'm having trouble for some reason finding it. Because it's not there. Oh, I'm sorry. Here it is. So Jill. Little technical problem, sorry. In the scenario, you mentioned that Joe, there was an issue with when it was cold in fire drills. How does that impact the outcome and support for Joe?
That's a really good question, and that is another reason that we need to be looking at that. Again, we don't have the information to talk about that, so an opportunity, being aware that he doesn't like the cold, would be to go in and see what else we can do to assist that. But the cold is one of those things, and you may notice that he does not, I didn't say, but he doesn't live in Hawaii or San Diego. So he is a Midwesterner because I am. So there are those cold days, 17 below, especially of those evening ones. So that would be another reason that we would be aware and be looking further.
Okay, so Jill, if the person would, if the staff would perhaps put blankets by the door, or as soon as there's a fire, start up a vehicle that he could get in the vehicle, would that maybe be a support that they could put in place? If
Yes.
that,
No,
okay.
yes. Knowing that you have, 3 minutes to evacuate, but perhaps having the van outside or a car outside or something that's much warmer for him. It might, it could be a number of different things, but yes, I think that would be a really great idea.
So how do you account for a request from a parent, for example, to intervene for safety in an inappropriate manner? For example, somebody has a rights restriction or outside acceptable practices.
When we're talking about safety, that would probably be something that we'd be looking at in rights, which will be, I believe, the next grouping of webinars. Parental issues are always, and guardianship issues are always not a slippery slope, but something that needs to be talked about and reviewed. I don't know if it would be in this area. Kathy, do you have any other?
Again, I would agree with you, Jill, that we'd be looking at what specific is that request and how does it interfere with the person's rights, those kinds of things. And so, for example, I did an interview recently where someone had been was having difficulty crossing streets safely, and one of his favorite things to do, and one of the things that he had done for many years, was to take walks after work. And so, but they got some complaints from the community and from other people who had seen him, other members of the community, that he wasn't crossing the street. And so they restricted his alone time in the community and made it so that he had to relearn appropriate walking. Well, initially that safety intervention would seem to be very appropriate, but if it goes on for 2 years or more and there's no real criteria for when the right would be restored, we'd probably be looking at that as in the area of rights. So another question, another question for a fire drill or an emergency situation. Is the outcome still present if you can answer yes because the individual receives assistance?
So, are you talking about physically moving people outside of the home? Assistance in the additional considerations in safety, it says if the person cannot evacuate independently but receives assistance to evacuate, the outcome is present. And that is true. But if it goes beyond that to where we have to physically assist people, that goes into a different realm. But if I would know, or Joe would know, what I do at that point is just wait for assistance and they will come, then yes, the outcome could be present.
Okay, and another question regarding support. Are we looking for responses that are about the agency policy or practices specific to the individual?
Policies and procedures don't necessarily make a life. We know that policies and procedures indicate that everyone must have a fire drill on a monthly basis. However, the supports of that would be that is specific to Joe.
So having a policy to have regular fire drills or have a blanket by the door wouldn't necessarily make this practice, make it an outcome or a support, unless that's what was really happening for Joe.
Right. Well, the policy is, of course, that we have fire drills. The blankets by the door would be specific for Joe, or the van being warmed up, or those sort of things.
Okay, good. Thanks. All right, I'm going to say it again and see what happens. That there are no other questions.
Okay, and we need to move on. So thank you. If you have other ones, let us know and we'll be in touch with you. Joe at times will cry and yell in high-pitched sounds. The staff have begun to log times when Joe's upset per request of the behavioral analyst. They have been keeping data for about 3 months. Staff do not know what is happening with the data, but have noticed that mornings seem to be the hardest time for him, especially when day program van arrives to take him to the day program. Staff have included a one-on-one time with Joe prior to the van arriving, explaining what is going to happen next. There also seems to be one staff member that he prefers, and one housemate that he does not prefer. There are a number of incident reports on file regarding this man who targets Joe at home by teasing, and staff attempt to keep Joe and his housemate apart, especially in the morning. So poll says, does Joe understand the meaning of abuse, neglect, exploitation, and mistreatment? Have there been allegations by or on behalf of Joe? Is there any evidence that Joe has been abused, neglected, exploited, or mistreated? And final, is Joe experiencing personal distress from any occurrence? Is the outcome present? Everybody poll?
So Jill, the results are that, 13% of us think that the outcome is present, and 87% of us say no, it's not present.
Very good. Can I go back to the scenario now? And that is what our poll has said also. So very, very good. If you have caught it that we don't really know why he's crying, we don't. The incident reports with the housemate and that morning transition time of going home where we know it's there, but what are we doing about it? Very good. So allegations for free from abuse and neglect for the supports, are there allegations, and do people recognize and are they supported in that? Knowledge of concerns, education of the person, support of danger or risk of harm, and are all allegations reported and investigated? This is another poll. Are supports in place? Yes. No development plans, no aware, or no, not in place. Please poll.
So Jill, the results are in, and we have 5% of us saying the supports are in place, 34% no, but they're developing plans, 45% no, they're aware but have no plans, and 16 no, their supports are not in place.
We will agree with that they're aware, but no real plans. They're trying to do some things, but the data isn't in, and the incident reports and staff are trying to do what they can do, but they need to do some more opportunities for that. Questions?
So, Jill, on the idea that there are that he's having some issues with his roommate, would it be helpful to know more information about how effective that strategy of keeping them apart is?
Of course.
In making our decision?
I'm sorry, and what?
In making the decision.
Yes. And the data points, the data points that are looking, we need some more of that. They're aware, they are aware, and there seems to be some plans being developed, but not to a robust area of being really aware, and staff are kind of grappling on it on their own. And so that holistic, it could be anything from Joe having to sit beside this person in the van, we don't know, or in his transport. And so there are a number of opportunities with this scenario to gain more information.
Okay, we have a couple of questions. If he continues to be targeted by his roommate, then would you expect there to be a recommendation for one or more of them to move and be separated and live in different homes?
Well, that would certainly that could certainly be the option for it. There might be other things that could be done, but we would recommend looking at that, but we would still need to have some more data and be talking to the staff and direct support staff and having them be a part of that decision, as well as Joe, of course.
Okay, and the fact that they don't understand the data might indicate that there's more that they should be aware of. They are trying to address what they are aware of, but they don't really know the whole issue. Is that right?
Yes.
Okay. Due to the fact that there are active attempts to gather data and support to give him the one-on-one with separation from the person who he doesn't get along with, wouldn't this action showing support developing of a plan but not no plans?
It certainly could be. However, being that it has been over 3 months with the data and there have been no changes in that, it seems to have just kind of been forgotten, and no one is following up on that. So simply collecting data doesn't necessarily make a plan.
Okay, so at a point in time, that may have been, that supports may have been stronger and robust enough to say the supports were there. But at this point in time, you're suggesting that it's not. Is that correct?
That's correct. Yes.
Okay. It looks like, what is a reasonable amount of time to gather data?
That's a good question. A reasonable, it might be 3 months. However, what we're missing here is any follow-up at any time. Those, that data should be at least, most organizations, data is looked at least on a monthly basis, and being that it's been 3 months without any kind of feedback for that would be too long.
Well, and it's true. And one of the things that we would expect, Jill, isn't it, that there would be, you'd continue to gather data even as you were putting interventions in place to show change or no change to evaluate the effectiveness of intervention. So, a reasonable amount of time is, you have to collect enough data so you can make decisions, and then you have to collect data so you can evaluate and continue to make decisions.
Yeah, you're absolutely right. It's that gap between 1 and 3 months. Okay. Because staff are trying to do something, but they're doing it kind of just because.
Okay, and then if Joe is reacting this way right before going to the day program, shouldn't the staff be checking with the day program to see how he is doing there, or possibly looking at what other options for him, maybe a different day program or something different for him during the day?
A very good question, and it might be the van, it might be where he's sitting, it might be the day program. Of course, we would look at it the holistic sort of way. The residential staff is not getting that information. The communication gap is there also. Right,
and we know already from Joe, because this is Joe's interview, and so we know from safety that he was concerned about the cold.
Right.
So that could be even part of it on the van, is the temperature variation.
Right, and it could be that this is, it's the December through March.
Right.
But we only have the last 3 months. Right.
Right. So we could be hypothesizing, and really we need to keep looking at that. As simply an interviewer, is it appropriate that you make suggestions as to what the agency should or should not do?
As an interviewer, we are not there to fix. However, there are times we don't really do a should or should not, but there are times that you might want to look at instead of you should be doing this. Because we really are gathering the data for that, and so Kathy, I mean, you can jump in here too, but I think having suggestions for folks to maybe take a look at with a new set of eyes would be appropriate, but we would never say you should or shouldn't do, unless of course it was health, safety, or well-being, or abuse and neglect, so.
Well, and actually the next person's question says, don't we really need to be careful not to focus on getting at solutions, but frequently want to, as an interviewer, to gather information to determine if the outcome is present or not. And so I think,
Yes.
you know, from that point of view, that is our focus, is to gather information. When we have conversations with staff, and depending upon what, or the follow-up, depending upon what's going on, or even with the person, sometimes there are suggestions that are made to be, you don't want to ask the question if you aren't going to do something with the information. So it might be that you would make a recommendation or a suggestion to the team for their consideration, but it's not necessarily a directive. Does that make sense?
Yes, we don't say you should or shouldn't. Yeah.
All right, then that concludes our questions.
We are talking about Joe's health, the best possible health, and what we're looking for in this for the outcome is that he defines it, that it's unique to him and personalized. Joe has numerous health issues, including diabetes, high blood pressure, high cholesterol, and anxiety. According to his doctor, he needs to lose weight, so has prescribed a 1,300 calorie diet. Joe takes medications for all of his diagnoses prescribed by his primary healthcare physician. Assessments have indicated that Joe has no interest in taking his own medicines. All health care is tracked by a staff nurse, and Joe is taken to his appointments by a designated medical staff. Joe does not have a guardian, power of attorney, nor proxy for health care decisions. He needs some dental work completed, and the organization is looking into avenues of payment. Poll says, does he see healthcare professionals? Have healthcare professionals identified his current best possible health? Health interventions been selected by Joe, and interventions been effective? Is Joe receiving health care as recommended? Is the outcome present? Poll says.
We're pretty split on this one, Jill. About 44% of us say yes, and 56% say no.
Okay, CQL, and not CQL, I'm sorry, decision-making questions indicate that the health care is not present. It is because we say that it's an assessment, have indicated that Joe has no interest. First, we need to look at that a little bit more. We know sometimes the assessments are simply that he doesn't speak, and so that he doesn't that. Healthcare is tracked. He needs some dental work, and we're looking for it, but he doesn't have the dental work completed at this moment. So at this point in time, the dental work that's needed is not present for him. He also, for that education part, without a proxy, without somebody helping him, or a power of attorney or whatnot, we don't know who is making those decisions for Joe. So for the decision making for health, in the outcome, he does see personal health care professionals, and they've identified with a 1,300 calorie diet. Selected by the person. We don't know if he likes that 1,300 calorie diet. Consultation, we don't know if he's losing weight and if those have been effective. And so we have an opportunity to find out a little bit more about what Joe might or might not. And one of the things is that we're always looking for people to be a part of their healthcare. So we want to look and make sure that Joe doesn't have any preferences for doctors, for any of those things.
So, Jill, in looking at this for Joe, I don't know that you've mentioned his age.
I have not mentioned his age.
So what would be helpful in terms of, why would we want to know his age?
We would want to know his age, of course, for all of those health care screenings, cancer screenings, and all of those things. And we do not know that yet.
So, if you didn't include it in information, most likely it wasn't important to this outcome. Is that correct? So we shouldn't be reading stuff in, right?
Well, it's important for this outcome. There are other things that are present that would make it not present, specifically the dental work. When they get those things together and the 1,300 calorie diet, this outcome would then be present with the information that we have.
Okay, all right, thank you.
And that's a really good point. And so all of us that go out and do interviews, we really do need to know people's age, and that's why we ask during training, be sure and give us kind of an idea of where ages are for people. As we know, personal outcomes and outcomes individualized to people change. And so, even though it's not there, and he might very well be, except for the dental work. And we do know that that's a problem for payment.
Is it significant that his medications for all of his diagnoses are prescribed by his primary physician? Are there specialists, for example, of behavioral health specific to anxiety that should be consulted? Is his anxiety related to his living situation?
Good catch. That's a very good question with the anxiety for the primary healthcare physician. Not too long ago, I was interviewing someone who had 4 antipsychotic medications and were all prescribed by the primary healthcare physician.
So generally speaking, we would expect there to be some specialist, even though in some organizations, there's a requirement that the primary care physician order it. We still would be expecting to see that there's consultation with a specialist who then makes recommendations and the primary care physician prescribes.
We would say so, yes.
Okay, all right. As there is no indication of Joe's active involvement in or knowledge of these issues, doesn't that mean that the outcome is not present?
Yes, the outcome is not present, yes.
And that would be an important consideration. And so sometimes when we say an outcome is not present, what tips it over the scale is the dental work, whereas it also could have gotten tipped over the scale because there's not any indication of his active involvement in learning about and really self-managing his own healthcare supports.
Yes, and tipped over by the primary healthcare with the anxiety. Yes.
So these are both good catches in terms of looking at the whole picture, and we could certainly list all of these as reasons why the outcome is not present.
That's correct. We will go to the supports then. The key points are education, support to manage and direct, and access to healthcare services. Does Joe define his best possible health or supports in place to maintain it and obtain regular health care, response to changing needs, education of medical issues and supports for self-management? Are supports in place?
So we have the supports in place. A few people, 7% said the supports are in place. And then we're pretty well split around developing plans, aware but no plans, are not in place.
Split kind of all the way through?
Right, so 26% said developing plans no, 38% said no, aware but no plans, and 29% said no, not in place.
There are some things in place, and they're aware of a few things. They're looking for dental work. They're doing some of those other things, but developing plans to figure out self-management or is not present. Developing plans to find an additional doctor or someone other than the primary for his anxiety is not in place that we can find. So it is number 4, no, not in place.
Okay, so we have a question about what are some ideas or some best practices around when the physician has prescribed psychotropic medications as a PRN and refuses to change the way that he or she prescribes them.
PRNs for psychotropics such as, you know, Adderall or Ativan or those things.
Okay.
PRN medications for anxiety and all of those other things, unless you are self-managing those and the person can self-management, we do not see that as a best practice. For a layperson to be doing those things is very difficult, and we would not say that's a best practice. PRN for a headache is very different.
So what are some ideas about how to get the physician to not prescribe them? What are some suggestions?
I see what you're saying. You know, organizations have to build relationships with their doctors to kind of figure that out. Human rights committees can maybe help you come up with some ideas for that. It's really building that idea that the organization doesn't do that, and you know, if there is a proxy, that person should be able to come in, a guardian, a power of attorney. It's really building those relationships and maybe looking for alternate ways of if I'm upset, do I take a walk? Do I just go into my own room or my own space? Is it, you know, what are the reasons around? So we're really doing those kind of assessments as to what that would be. And so, you know, we don't see that as a best practice.
Okay. All right, thank you. So the next two questions are similar, so I'm going to kind of morph them into one. The observation is that there was a big variance in whether or not there was awareness and no plans, or whether there were, you know, the supports weren't in place, or and so how does CQL look at that when they're in the database? And then how important really is it that the right no answer is identified?
You know, the database just I believe is just that, so that we can look in it and give well, Kathy, maybe you need to answer that.
Okay, so for purposes of reliability, we're still just looking at yes and no. So when we do your reliability assessments, we're looking at whether or not the supports are in place or they're not in place. Really, the benefit of developing plans, aware but no plans, and not in place, is to allow agencies to look at their improvement over time. So so when you're putting it into the database, we expect that really no means that we're actively involved in figuring out what to do. We're having team meetings, we're reviewing suggestions, we're maybe writing them down but have to go through the approval process. And aware but no plans really means, you know, you're kind of at the point where you know, it's a real informal, you know, you're talking about it, but it's not anything that's gotten pen on paper or fingers on keyboard. And no is that it's just simply not in place. There maybe wasn't even an awareness of that there were any, that there was even an issue. So of course there's not anything in place. Or other times, you know, one of the supports can be, and not necessarily for this one, is that, you know, we stay out of the way, but it has to be an active decision to do that. So, so the main reason we put these different variances for no in there is so that you could look at your improvement over time. But in essence, we're really looking at yes and no is the most critical answer.
And thank you. And so for Joe, the tipping point is the anxiety medication, or one of the tipping points is the anxiety medication.
So the next question, Jill, and I think you've kind of answered that, is please review again why it's no, not in place, versus no, but developing plans. Where's our emphasis? And you're saying the emphasis is on the fact that the anxiety medication is prescribed by the primary care physician and there's no indication that there's any other kind of specialist involved.
That's correct. And that's one of the tipping points. Another tipping point is self-management. I mean, what are they doing? How are we educating? But the one that would have tipped it for me is the primary care with the anxiety medication.
So then the next question is, how does Kathy, my response, affect the reliability recertification interviews? And so when we come out to do your reliability assessments, we can certainly talk about developing plans, aware but no plans, but not in place. We are not assessing, we assess yes and no. So there are still only 42 different support answers. So it can be yes, it can be no. So it doesn't, so my response is, in essence, during reliability, we're just looking at yes and no.
And last but not least for today is that people experience continuity and security. We're looking for control over change and economic security. Joe has enough money for the things that he needs from his disability payment. There is not a lot of money for extras, but staff report he doesn't seem to want anything. He has Medicaid for his medical needs except for dental work. He has lived in his present home for 2 years. Prior to that, he had moved a number of times due to reorganization of living situations. Excuse me, staff report that Joe doesn't really mind changes in schedules other than in the morning or if his preferred staff doesn't come into work. Staff work diligently to find the best things for Joe and adjust as he indicates changes they believe he wants. Assessments indicate that presently Joe is happy with the way things are. The questions: does Joe have economic resources to meet his basic needs? Any financial protection for himself or his belongings? Have changes occurred in the past 2 years and who is responsible for those? Are there changes anticipated in the next 2 years? And is control over changes similar to that exercised by other people? Is the outcome present?
So Jill, we have 80% of the people on the call saying no, the outcome is not present, and we have 20% saying yes, the outcome is present.
The outcome is not present for this, in that he has economic resources to meet his basic needs. We don't know about the protection for himself or his belongings, and he makes no changes for himself. He was not responsible for the changes, although I know he's been there for 2 years, but any of the other things are not present for him in those changes. Nor does he, again, if we think back, he does not have anyone designated to help him make those decisions, a proxy or power of attorney. So pretty much his life is kind of like, even though he says he's happy, happy does not necessarily equate to choice.
Okay, and Jill, one of the questions is the needed dental work not a basic need?
Well, we believe that everyone in the U.S. should have health. Sometimes we have to decide where that might fit best. We took that out as one of the tipping point, if you will, in his health. And it could certainly be a part of this, and it could be, part of saying, again, his basic needs aren't there. It's not the anticipation of it, but rather the choice making that he's not responsible for. Does that make sense?
It does. It does. So in other words, if the dental work, the need for the dental work had a huge impact on his life, it might affect more than one outcome. But based on the fact that it appears that that from the information we have, his dental work, it was effectively handled under best possible health.
Yes.
Correct. Okay. So can you provide an example of some of the questions that you might ask to get the responses in this example?
For Joe, we might be talking to asking some more ideas of how what assessments are being used. Is it an ongoing assessment that we're looking for? Are we looking for those things that Joe may or may not respond to in a positive or other way to help decide whether those are choices that he wants? We know we need to look at that morning again, because that seems to be the time when he becomes most upset and verbalizes that to us. We might look at that continuity and security of his preferred staff. I mean, how often doesn't the preferred staff come into work? Is there a way that we could help with that preferred staff in the morning? That preferred staff may be on the second shift, and maybe that would help with the anxiety in the mornings. To just kind of look at him as a whole person, to adjust those changes and see if we can maybe find a second preferred staff.
Okay, great. It looks like that's the end to the questions. We are right at 11 o'clock, so if you can hold on, we'll go ahead and do the next poll and discussion. And hopefully, if you can't, then you can listen to the recording, just this last part of it, if you'd like.
So the following for the support is to minimize disruption, maintain stability, and system advocacy. Does the organization know what is required for Joe to experience continuity and security, or are efforts being made to learn? Are supports provided to assist the person in attaining and maintaining continuity and security? Are supports in place? How much time do they have, Kathy?
Just about 3 more seconds. So Jill, it looks like a few people think the supports are in place. Most people think they're not. There are a few that saw some developing plans. Most said aware but no plans. And many said aware but no plans. Most said no, not in place.
Well, surprisingly, I had this in place. There are efforts being made to learn about him. There are some other things that could be done, but there are efforts. They're looking for the morning things. He's been in his home 2 years. The advocacy for that, requiring him to experience that, or efforts being made to learn. They're supporting him to as much as they can see at this point for it. We had that the supports were in place for continuity and security. This is one also to look at for your organization, those efforts being made to learn. Staff are looking, they're adjusting things, they're trying to, yes, there might be some other things, but the efforts are being made to learn about that. Some additional questions might be there, but they are keeping him, they're looking for his preferred staff and doing those. I think that we have, I don't think, but we have looked at those other things in his health and other areas that the supports are in place for him at this point, with that efforts being made to learn.
I think that one of the things that when I teach this class that we talk about is that for the supports, part of what we're looking at is what does the agency know, what are they trying to learn, and what are they doing with that information, and then are there things in place that help to facilitate this outcome being present for that person. One of the questions is, interpretations seem so subjective as evidenced by our divided responses. How do we all overcome that?
Well, that's a really good question. I think what Kathy just said is, what do we know, what are we learning, and what are we doing? If we look back on Joe's whole life, we're looking at diligently trying to find the best things and adjust for indicated changes. We're looking to make sure that his health is good. We're looking for, to try and keep the people apart. The gentleman that teases him. There's some of those things, but they're working very diligently on that. We don't have that we don't know how many incident reports and what's been done with that. The efforts being made to learn, and are those robust, and according to the scenario above, is that the diligence of the organization to looking for those things and being aware of that and making changes as Joe indicates, wanting changes, that we're really supporting him in that area.
So, and that's an excellent answer, Jill. I think too, one of the things that's one of the reasons why we're wanting to do more of these kinds of presentations, and we're actually planning another session later in the spring or summer around where you're able to submit some scenarios to us and get our responses to it. But I also wanted to say that that it's also very important to look at the person in a whole. We're not just looking at each outcome by themselves. Sometimes what we know about one outcome impacts other outcomes, and so we need to make sure we're looking at the person as a whole. So there are a few other questions if we have time. So are the slides available to be printed? We will be sending you a link to a PDF of the slides, so they will be available to you. If the outcomes and supports are not there for abuse and neglect, how can the support be there for continuity and security?
It's the efforts and the changes that people have made for that. The abuse and neglect is looking, it's a teasing with that person, and they are working diligently again to try and find out why that is and where the person is going. Those two don't always necessarily link, and it would be to the rise of that abuse, neglect, exploitation, or mistreatment.
Then there was a question about what support is in place to protect his belongings.
Well, that's a good question too. All in all, I don't know how to answer that. The efforts for the questions of this, the outcome is not present there for him, but the supports are looking at that for him. I mean, the supports are the efforts of that. So outcomes and supports don't always cojoin, if you will. That would be something they would be looking at in the outcome for it.
Okay, and then I wanted to ask one more question. So if staff thinks that Joe is happy but has not asked him or received a response from him, how do we know that the outcome support is in place?
Happy is one of those questions, isn't it? We have to continue to assess that and looking for the best things for Joe and adjust as he indicates changes. Happy with the way things are, just simply because we are content, it doesn't necessarily mean satisfaction or that we have actually asked. It's that ask and act, and we need to just keep watching for Joe because his the way he communicates is different than the way that we communicate.
Right, and when people tell us that people are happy, we're also looking for evidence of why they say that the person is happy. What is it what is the evidence that they're presenting to us about someone affect or how they feel about things? Why do they say that? And it can be as concrete as, why do you think the person's favorite color is red, to as abstract as, why do you think that he doesn't like to go out with certain people or to certain kinds of places? It's because of his reaction and what happens when he's there. But his affect, when he's content or satisfied, we get a different response. So, Jill, we've kind of exceeded our timelines. I think we've answered all of the questions. We'll go through them again before the next presentation and make sure that we haven't missed anything. If you have a question that we didn't answer, please feel free to email either Jill or myself. So thank you all very, very much for your participation and your involvement. We'll look forward to you participating in future webinars.